In this lesson, we'll continue our discussion of the heart by taking a look at the superficial features of the heart. These are things that we would see on the outside for the most part. We'll then take a look at the heart wall, which has three layers to it, and then we'll finish it up by looking at the connective tissue of the heart. So let's start with the atria. The top two chambers of the heart are known as the atria. Each of the atria has this outer pouch that has the ability to expand, known as the auricle. So if we were looking at the front of the heart over here, this area here, if we were looking inside, would be a cavity known as the right ventricle. Inside here would be the right atrium. On this side we would see some of the left atrium, and then over here we would see some of the left ventricle. So if you notice, the right atrium has this expandable pouch going out over here. This is known as the auricle. This would be the right auricle, and then over here we're just seeing part of the left auricle over here. We would have to actually turn this picture a little bit more to see the whole atrium and the auricle. These two pouches are able to, like I said, expand. They can absorb extra blood if there's a lot of blood returning back to the heart. The anatomist probably named them auricles because it resembles an ear, right? It kind of looks like an ear if you use your imagination a little bit. And the outside of our ear is known as the auricle. Okay, so we can definitely see them very easily from the front. Actually, how do you know we're looking at the front other than they're telling you on this picture? If you go to a picture of the back for a minute, one of the things that I look for to tell me that I have a posterior view, this big blood vessel here is known as the coronary sinus. It's a big vein. I'm going to talk about that in a subsequent lesson. This is always going to be on the back. So whenever you see this, you know you have a back view. Right, you don't see it here, so it's going to be an anterior view. It's going to be from the front. Okay, so the first two structures that are external features are the auricles. Now, there are some grooves on the heart known as sulci, right? A sulci is nothing more, or a sulcus is a shallow groove. One of the problems with looking at sometimes a picture or even a model or a real dissection is that the sulcus is going to be filled with blood vessels and fat, so it's actually hard to see the groove itself. So you have to use your imagination a little bit. The first sulcus we want to take a look at is a sulcus that's right between the atria above and the ventricles below. So it kind of goes around the whole heart, and it separates a little bit the atria that are going to be on top from the ventricles that are going to be down below. It's known as the coronary sulcus. So here's the atrium on the right, and here's part of the atrium on the left, filled with fat. This whole area here is fat. This fat and these blood vessels are sitting in the groove right here. This would be where the coronary sulcus runs. Then if I turn the heart around, the coronary sulcus will continue around this way. And then again, if we turn it around again, it'll come back over on this side here. So the coronary sulcus, you need to know, separates the top of the heart, the atria, from the ventricles. Before I go back to the note, the next structure is going to be the anterior interventricular sulcus. So let's dissect those words before I show you. Anterior means the front of the heart, and this is the correct picture because it doesn't have that coronary sinus. Then interventricular means between the ventricles. So over here would be where the left ventricle is, the chamber's in here, and then over here is the right ventricle. This, again, filled with fat, there's a groove or a sulcus that runs down here known as the anterior interventricular sulcus, and it houses fat, and you will see some important blood vessels also here. The red and the blue are very important blood vessels. We'll talk about them in another lesson. So this would be the anterior interventricular sulcus. And then if we go to the back of the heart, also interventricular between the left ventricle and the right ventricle, is a groove that runs down here. It's filled with fat and again blood vessels, known as the posterior interventricular. So this is running down the back of the heart. Okay, so those are our next two structures, the anterior interventricular sulcus and the posterior interventricular sulcus. They're going to be both in between the ventricles. Again, one is going to be on the anterior side, the other one's going to be on the posterior side. And again, what makes them a little bit hard to see is the fact that they are filled with fat and blood vessels. But that's normal. Okay. So let's take a look at the heart wall itself. It turns out that the heart wall is made up of three distinct layers, right? Three layers. What we're going to do, guys, is we're going to look at the heart from the outside in. So the very first layer that's on the outside, we actually talked about in the last lesson when we talked about the pericardium. This is the visceral pericardium. Right, this is the lining that actually lays on the heart. You can either call it the visceral pericardium or the epicardium, right? Epi means upon, cardio means again the heart. So your choice, you can say that the outermost layer is the epicardium, also known as the visceral pericardium, or you could just say either or. They are totally both correct. And again, they're going to be on the outside of the heart. Going in now, the thickest layer is going to be the myocardium. Right? Myo means muscle, and like I said, this is where it's going to be the thickest, but this is where the cardiac cells are going to be located. The cardiac cells that are actually doing the contracting, they're located in the myocardium. The final innermost lining, it actually faces the blood and lines of the chambers, is the endocardium. Right? Endo means within. Right? So this lining is a lining on the inside of the heart. If you were to look at it underneath the microscope, you would see it as a nice simple squamous epithelium. Right? It has a little bit of connective tissue under the epithelium. So I'm going to show you a pretty good picture here. So what we're going to do is actually take the pericardium that we did in the previous lesson and kind of tie it together with the heart wall. So what they did here, they took a section through the pericardium and the heart. We looked at this picture in the last lesson. So if you start way out here, this white connective tissue here, and then a little bit of connective tissue underneath it right there, this yellow, all of this is the fibrous pericardium. That's that tough bag that is around the entire heart structures. Then lining the inside of the fibrous pericardium, if you look here, these simple squamous cells, this would be the parietal pericardium, right? So this is parietal. If you remember from the last lesson, lines the cavity wall. This produces a serous fluid that now goes into this space right here where my cursor is running. This is the pericardial cavity, and that's going to be wet. It's going to have the serous fluid in there. Now, this represents the heart wall now from here all the way to here. This is going to be the heart wall. So this white layer of cells here is also simple squamous cells. That would be the visceral pericardium, or you can call it the epicardium. Again, your choice. They would both be correct. And then underneath these simple squamous cells is a little bit of connective tissue here. As a general rule, guys, whenever you see epithelium, underneath it is going to be a little bit of areolar connective tissue. Look at this, the thickest layer here is going to be the myocardium. So all of these cells here connected together are cardiac cells. And so that's going to be the myocardium. And then finally, the innermost lining, so this would be like a chamber here of the heart. Let's say it would be the left atrium or so. Lining the inner chambers of the heart is a simple squamous epithelium here, and then again a little bit of connective tissue. This would be known as the endothelium, right? So all of these simple squamous cells here are making up the endothelium. Right? So we just looked at the heart from the pericardial sac on the outside all the way through all the different layers until we get to a chamber on the inside where the blood is flowing. This is a picture just kind of showing the myocardium, how it's distributed. You can see the myocardium around the atria kind of do like a figure eight type of thing. They kind of go around the blood vessels up here, the great vessels, in a figure eight. And then here they kind of form these bands or these sheets of muscles that go around the ventricles, right? So they run a little bit differently. Okay, the last thing we want to take a look at in this lesson is the connective tissue of the heart. So some of the thing the connective tissue does for us, it's going to physically support all of the cardiac muscle, the blood vessels that are on the heart, and then the nerves of the myocardium, right? If you take a look at those great vessels like the aorta, the pulmonary trunk, the vena cavas, right? They're really big blood vessels. They need to be supported. They help. The connective tissue also helps to distribute the forces of the contraction, so it goes through the heart. It even adds strength. And here's another important function. It's going to prevent overexpansion of the heart. When we talk about cardiac physiology, we're going to see that sometimes a lot of blood returns to the heart at one time. The connective tissue is going to prevent the heart from overexpanding and causing damage. And then after the heart contracts, we want to be able to return the heart back to its original shape, its normal shape. So the connective tissue provides some of that elasticity to return the heart to its normal shape. Now, part of the connective tissue of the heart is known as the cardiac skeleton. These are dense bands. You can see there's four of them of a very tough elastic tissue. And here's some of the things that these cardiac skeleton does for us. First of all, it's going to encircle the heart valve, the valves, and the bases of the pulmonary trunk and the aorta. Right, so it's basically going around all of the heart valves that we're going to study in the next lesson, and then also kind of support the great vessels that are coming off the heart. It helps to stabilize the position of those heart valves and then also the muscle cells that are part of the heart. But one of the most important is this third dot. We're going to cover this when we get into the conducting system. We're going to see there's an electrical signal that goes from the atria and it heads down towards the ventricles. But believe it or not, we don't want that electrical signal to go down into the ventricles from above down. So there's kind of like the cardiac skeleton is acting like an insulation that's going to prevent the atrial cells from electrically stimulating the ventricular cells. And I'll get more into that a little bit in a few lessons down the road. It's a little bit advanced at this moment. Okay. So that concludes our lesson on the external features of the heart, the heart wall, and the connective tissues. The next lesson will be the internal anatomy of the heart.